Urethral strictures of the kind which are posterior urethral distraction defects, the defects which result from a high-speed road traffic accident or a fall from the height, which is a huge amount of impact in the pelvis, where the changes happen which are acute, aggressive, gruesome, fractures of various bones uh, in the pelvic cavity, which brings about complete disorganization with bleeding, with trauma, with avulsions at the level of this narrow tube called the male urethra, or even in females where there are road traffic accidents and damage of the urethra, lead to those kind of defects, which actually are from where we are not able to initially catheterize these patients. All these patients who have got posterior urethral distraction defects as men or as gross accidents and traumas with the female urethra is completely disrupted, where the catheter cannot be placed in that acute traumatic setup, are stabilized by various departments. They are stabilized to a level where they survive and the organ systems are recovering. The urological help at that point in time is called a suprapubic cystostomy. That means we place a catheter through a hole in the lower abdomen in the region from where the bladder can be directly approached without disturbing this haematoma, which is a fracture haematoma, and place a catheter and therefore drain or divert the urine from the suprapubic region or from the lower abdomen. A suprapubic cystostomy stays in place and undergoes a monthly change, while patients of posterior urethral distraction defect undergo various kinds of therapies in their orthopedic care, which means the various fractures are stabilized, various other injuries are treated care of. There are times when there could be rectal injury and there could even be a colostomy and ileostomy for passing motions, which are also diverted to. So patients with these kind of road traffic accidents, sadly, which disrupts various aspects of bladder and bowel care, are patients who have challenges in reconstructive urology. And that's where posterior urethral distraction defect or urethral strictures, which need to be treated at reconstructive units across the world, where reconstructive urologists take this forward to very high levels. We have been blessed by teachers who have trained us on this art. And today, in the last 24 years in urology, have been able to take these patients who have got obstruction to the urinary passage as a result of disruption to the urethra. The urethra in males, which is an anterior urethra called the penile and the bulbar urethra, and a posterior urethra called the prostatic urethra, where there's a junctional urethra called the membranous urethra at the level of the sphincters of the control mechanisms, undergoing organ injuries and damages where there is a complete disruption, and the urinary pipe undergoes a change, where this important urinary pipe, which you see, actually undergoes a change and the distraction defect of the bones, which fracture and therefore impinge into the urinary passage here at the level of the sphincter, could actually cause a damage. So that damage which happens as a result of the fracture pelvis, where this bone completely impinges on this part and this trauma here could actually not help us to improve the care at that point in time to put a catheter through the urinary passage, where we put a catheter through the abdomen directly as a suprapubic cystostomy, helps us later on to enter the bladder through the suprapubic cystostomy by a cystoscope, identify the trauma levels here and the distraction, which has been studied by MRI, CT scans, and finally taken forward to the highest possible levels of repair. So posterior urethral distraction defect, a stricture urethra resulting from high traffic, high speed road traffic accidents or injuries happening in both men and women, where there are pelvic fractures, injuries, and various kind of issues, and patients are living on suprapubic cystostomy, is a wake-up call. All those patients who got injured months ago to years ago and have not got a lower urinary passage repaired deserve a treatment called urethroplasty. So urethroplasty happens to be that kind of a treatment where we go in and repair that damaged segment and repair the segment by either bringing about the two segments closer and excising that extra amount of fibrous tissue where the injury or the trauma took place, and the disruption is therefore brought into continuity by an anastomotic urethroplasty. For a reconstructive urologist who does this in various centers in various countries around, he looks at bringing about anastomosis, a repair, where he brings about a spatulated repair. The repair is a tension-free repair. The repair is brought about where there are various mobilizations happen anteriorly, because distally, you can't have much mobilization. You have the male organ, and you don't want a deformity or an angulation or various kind of curvature happening in the male organ in more prime of life of these men who are still very young, married, unmarried, sexually inactive, or possibly lost those because of the injuries which has happened to these patients. So friends, posterior distraction defect is a kind of trauma developing in the region of the posterior urethra, which is a junction between a prostatic urethra on one side, and it could be the entire anterior urethra at that point in time could possibly not have a continuity. Various kinds of repairs that we get to do are redo repairs where patients have undergone treatment, but still the suprapubic cystostomy is there and the segments have again caused stenosis, or tightening, or continue to still stay completely occluded. These repairs are challenging. These repairs require that we enter your body through the perineum. We get in and we also take help of the suprapubic root. The suprapubic root, or the root from the tummy where the catheter is placed, where you are living on a SPC, a suprapubic cystostomy, allows us to take this entire approach where we can do maneuver from both sides, reach, identify, remove those excessive tissue, which is all fibrous, damage, which don't have a blood supply, and therefore join these two together. Urethral strictures as such are very challenging because that is about a replacement of an organ, which is itself a very narrow organ. Remember urethra? Urethra happens to be as narrow and as thin as your mobile charging wire. Very narrow. It could be 2 to 3 millimeters, 4 millimeters kind of a tube with some amount of distensibility in the bulbar urethra, whereas penile urethra is more fixed to copper cavernosa and surrounded by this copper spongiosum. The entire aspect of repairing this and treating it gives men back their urinary passage, or gives sometimes women who go through this trauma who are living on an SPC. So for you and me today in the society, it's a wake-up call that if somebody is living on a SPC, suprapubic cystostomy, that means there's a catheter through the tummy and not through low urinary passage. Why? Why in a young man who underwent a trauma probably has not been converted into the low urinary passage continuity which has been repaired? And that can be done by a urethroplasty. Various techniques that we do in redo cases and in primary cases could be out of the purview of today's discussion. But it's basically waking up the society towards an alarming issue which happened by a sudden accident or trauma, which has actually brought about changes which are almost looking irreversible for quite some time. Repairs may have failed, or possibly repair has not been taken forward. There could be no shortcuts in this because you want a proper anastomosis, you want a proper repair, and that repair should stand a test of time and a lifetime. And therefore, it is important for us to wake up all colleagues in the society who are men that if somebody is living on a suprapubic cystostomy, see your reconstructive urologist in your city and your country. Reconstruction, where the organ has either been lost, damaged, injured, removed, has to be repaired around, is itself a challenge. And in urology, those challenges are often huge. They are something where the expectations may be huge, and our capabilities may be limited a lot by the patient's own condition, the expectations, and obviously the tissue available which you bring about for repair. So to me, reconstructive urology, which has actually been a part and parcel of various aspects that we treat around, today it's a wake-up call for us to make you understand that this kind of treatments are available at wonderful centers where trainees, teachers, including my teachers who trained us around to levels where we have been able to, as a team in Kokilaben Hospital, done this teamwork where a group of residents, a group of consultants hover around your perineum, over your suprapubic region, spend those X number of hours and finally repair you to level from where you're done, and you got a continuity from where you pass. There are times there could be injuries to the nerves, and those possibly will not help to get the erections to those levels around. And the possibility of that going in a various completely different therapy, which could in one way be an intracavernosal injection of a therapy where pelvic injuries have damaged all the nerves, or more versatile cure, which are penile prostheses, which are available today and where we continue doing a repair, actually works very well. There are patients of these format who undergo urethroplasty at stage 1, n number of months later when they're stabilized and urethra looks wonderful, undergo the second stage, which actually happens to be nothing to do with the urethra, which has now stabilized and looks like stable for a lifetime, which anything between 6 months to 2 years, we go ahead and then do a penile process and give them the erections, which is a semi-rigid malleable in most of the time, but obviously we have got the wonderful, capable, and versatile inflatable process available too. So friends, urethroplasty for posterior urethral distraction defect, for road traffic accident, for injuries where a patient is living on suprapubic cystostomy, can't pass urine from below, is a huge wake-up call. They live in smaller towns and cities, in places where they may have possibly got a treatment and they've given up because the treatment could have failed. Failed urethroplasty requires a redo urethroplasty, and redo urethroplasty, though a challenge, has to be taken up by somebody. We're ready to take it here, as my colleagues take it in various centers in the world. And therefore, think positives, because each disease that we look at today has got a treatment. It only requires a partnership, and probably that partnership can happen by your first step. Identify the right person, the right patient, right time and right treatment. The doctors on the other side of the table are waiting to help you out, and they surely would help you. Good luck to you. so that this disease can be abolished, and as many of these posterior dissection defects are repaired timely, wisely, in ways to prevent a trauma. Obviously, it's a teamwork, and therefore it requires a huge amount of effort on the part of a surgeon and surgical team to allow this to take it forward, heal, repair, and possibly go to a logical conclusion where you can still continue to pass urine and paint on the wall like you used to probably compete in your childhood days. Good luck. All the best.